Check one, two. Good afternoon, everyone. Happy Friday. It is Friday, right? Um, Thank you so much. We're just a couple minutes late getting started today, but it's a pleasure to be here today. We will convene our JF meeting here and just will begin. I will actually begin with allowing our chairs and rankings to have remarks, and I'll actually conclude this time. So I'm just actually first, we'll begin with a little housekeeping note. We did have a technical glitch with the notice for our meeting. And I want to thank Representative D'Amico. And I want to assure everyone that we have worked together. We're very fortunate on our committee with our chairs and rankings. We talk frequently and often, and we have worked together to assure that that was rectified and have been in agreement and have worked according to the rules and all the legalities. And I just wanted to make sure that folks were aware of that in full transparency, as we like to do here at our meetings. Today actually this is our final JF meeting, nice and early. That doesn't mean the work is finished at all, as we'll talk about today, but I will turn it over first. Senator Amor will be joining us shortly. Senator, do you want to make any comments at the beginning?
Madam Chair, I'm just in the parking lot, but I just wanted to say thank you so much for everything, and we'll start.
Thank you very much, Senator Anwar. Senator Summers.
Yes, good morning, everyone. And I wanted to, or actually, good afternoon, everyone. I wanted to reiterate what our good chair has mentioned. We have agreed as a leadership committee to go forward with today, even though there was a glitch with the computers freezing for the posting of the agenda. I just want to make sure that this is not a precedent that we're setting. This is something that was sort of a series of unfortunate events that happened, but there was every intention to publish and post the agenda, which has not changed since it was originally posted. There's nothing nefarious here. This is simply the computer froze, and we want to make sure that everyone does have time to see what's on the agenda, and that this will not be precedent setting going forward. As you heard, this is our last JF meeting, so we really wanted to continue on with this meeting this afternoon, excuse me. So thank you, Madam Chair.
Thank you for that, Senator Summers. Technology, our greatest friend and sometimes our biggest enemy. Representative Clara DiStitrio.
Thank you, Madam Chair. Good afternoon, everybody. And I won't repeat what our co-chair and our other ranking already said, but we're moving forward. Everything is where it should be, and legal and leadership has taken care of it. So let's continue with our meeting. Thank you, Madam Chair.
Thank you very much. And with that spirit of cooperation and gratitude, we will begin our meeting today with item Roman numeral number 3, which are our bills to JF today. And I will, actually, we're going to begin first with item number 9 on the agenda, which is House Bill 5488. And from there, we will go back to item number 1. This is an act concerning various revisions to the public health statutes. This is a JFS to the floor. May I have a motion? Actually, LCO 3402. May I have a motion?
So move.
Moved by Senator Anwar. Is there a second?
Second.
Seconded by Representative Kitt. Thank you for that. This bill is the various revisions bill of our committee. As is often the case, there are a number of items that are included in this bill, and we work together as chairs and ranking members to assure that we have consensus on the items that we move forward with. I will say, though we do have some S language, this bill will continue to have some conversation, and as is often the case with the committee revisions bill, remain a work in progress throughout the course of the session. The bill before us does a number of things, including adding to the list of organizations from whom a clinical medical assistant may be certified, allowing the Department of Public Health to impose disciplinary action on a hospital, birth center, or outpatient surgical facility. It requires ambulances to be equipped with glucogen nasal power It increases from 12 to 24 months the duration of the postgraduate experience for the initial license for LMFTs, our licensed marriage and family therapists. It reinstates provisions relating to unfair trade practices and adds EMS organizations and healthcare institutions to a law related to unfair trade practices. It allows the governor to enter into an agreement with the tribes to allow them the ability to have birth and death certificates be issued and filed with the tribes rather than with the municipality. It allows the master social worker licensure candidates degree program from programs that are in the process of getting accredited. And it requires the commissioner to notify hairdressers and cosmetician license applicants that they be eligible for certain testing applications. We're almost there. It allows APRNs to perform fluoroscopy. It adds injection and infusion drug administration codes and makes some changes, technical changes. And finally, it requires the Department of Public Health to conduct scope of practice review on whether naturopathic physicians should be allowed to prescribe, dispense and administer medications. I will point out that the S language changes, there are some technical changes. In section 11, it combines the original section 11 and 12, which is adding that code, which I referenced, and then section 13, which I just referenced about the naturopaths, is a part of that S language. After that lengthy description, is there discussion on this item? Seeing and hearing no discussion. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker, Senator Summers,
Senator Summers votes yes.
Representative Clarides Detrier,
Representative Clarice Detrier votes no to flag.
Representative Belton,
Belton votes yes.
Representative Belton, I did not see you on screen, please. Thank you. Representative Belton,
Belton votes yes.
thank you. Representative Berger-Givallo,
Berger-Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes yes.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Dauphiné votes no.
Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes no.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Representative Cavers DeGraw,
Yes, on Zoom.
Representative Kidd,
Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan, Representative Morrow,
Representative Mara votes no.
Representative McCarthy,
Representative McCarthy votes no.
Representative Palm,
Palm votes yes. Yes.
thank you. Representative Perello,
Perillo votes no.
Representative Raider,
Representative Raider votes yes.
Senator Rahman, Representative Ryan,
Representative Ryan votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Senator Slack, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Waylando,
Representative Welander votes yes.
Representative Zupkis.
Zupkis votes no.
Thank you, Madam Chair.
Thank you, Madam Administrator. And continuing on, we'll go back to item number 1 and we'll follow in order from here. Item number 1, Senate Bill 9, an act promoting hospital financial stability. This is a JFS to the floor, LCO 3362. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Representative Berger Giravalo. Senate Bill 9 comes to us from the governor's office. This bill, which Senator Anwar may want to say a couple words about. I'm giving you the opening here. There are a number of changes to the certificate of need process proposed in this bill. It adds types of transactions that would need approval. It eliminates the CON requirement for certain CAT scanners. It allows a new $25,000 civil penalty for non-compliance. It establishes an emergency department diversion program. It requires reporting of certain hospital financial information to the Office of Health Strategy, and then requires the office to report that information to OPM. This bill is in part in response to what we've seen happen here in Connecticut with respect to the hospital systems, and to assure that we are protecting the residents of our state. I will note that, as we have said before in this committee, we have a number of bills on the certificate of need and related to financial investments in healthcare institutions. 2 of them we have already passed out of this committee, and 2 are before us today. We expect fully, in conjunction with our ranking members, to be in conversation with the governor's office, with the Office of Health Strategy, with the Attorney General who testified before us, and other stakeholders, our hospital association and providers, to assure that we come up with the best possible solutions to assure equity, access, transparency, value, and the ability to have healthcare for the people of our state. So we will have this bill before us, but again, keep in mind that it's part of a broader conversation. With that, I will go to Senator Anwar, to be followed by Rep. Clara DeStitrio.
Thank you, Madam Co-Chair. Could not have said it better. Every part of this bill is based on something that has happened in the state of Connecticut, which has threatened the well-being of healthcare institutions, but more importantly, the patients in our state. So it's based on a response to making sure that what has happened should not ever happen again. So while in these 4 or 5 bills that you'll see, which are related to CON, there are parts that many people would like, and there are parts that many people do not. The agenda is that we actually pass them out because of the time limitations, and then have a robust conversation and try to find the best solution with all the stakeholders in one place. So we look forward to this conversation, but we are hoping to pass this bill out of committee today. So back to you, Madam Co-Chair.
Thank you, Senator. Representative Clara DeStitrio.
Thank you, Madam Chair. As far as this bill goes, we know in the state of Connecticut that we have a process that we need to fix, and the CON, the certificate of need, is in dire need of some changes legislatively. No disrespect to the governor's office. I do not believe that SB 9 is the way to go. I think the one that we've seen before, we voted out of committee, 440, is the way to go. So I'm hoping with our negotiations moving forward, we can get the best of all these certificate of need bills together and pass some great legislation for the state of Connecticut. Thank you, Madam Chair.
Thank you, Representative Clara DeCitria. And you can see that this will require a lot of conversation. And this is where I'm grateful that we have such a great working relationship and we will be having extensive conversations, hearing from you, our committee members, and again, the members of the public and stakeholders. We remain available for those conversations, even as we continue, even as we complete our JF work here in committee. So, Senator Summers, and to be followed by Representative Zupkis.
Yes, good morning, and thank you, Madam Chair. I just want to make my comments in line with Representative Clara DeCitria. We have already voted out a CON bill, SB 440 out of this committee. I do not think that SB 9, with all due respect, is the way to go. And I do not think we need to continue to vote out all of these CON bills if we are all committed to working on a solution with all of us, that those could be easily incorporated into SB 440 that we have already passed out. I will be a no today on this bill, but I am committed to working to come up with the best CON language that we can that will promote access and equity in our healthcare system. I don't think this bill does that. And there are many states without CON that have great access and equity. So I think that's something that this legislature needs to consider also. Thank you, Madam Chair.
Thank you, Senator Summers. And I was remiss, Representative Carpino.
Thank you, ma'am. I have some concerns with this bill and a couple others, and I don't want to make the comments at every bill. So I will say them now. I think we all want affordable health care that is high quality in our state, and access is important. But I have concerns with the process when on our last committee meeting where we have a lot of works in progress. And I very much enjoy working with the chairs in this committee and the ranking members, but it becomes very difficult. Our bills are complex. Our bills are important. And when we're negotiating them in the hallway on the last couple of days, they don't get the public airing that they should. So I'm voting no today on this one, and more than a few I had hoped to see better language for today. I commit myself to working with anybody who wants to get them to a better place, but I do have concerns in our last meeting that there are so many complex bills that aren't ready yet.
Thank you, Representative Carpino. Representative Zupkis.
Thank you, Madam Chair. I'm not going to reiterate what my colleagues just said because I completely agree with them. The CON process is, I don't want to say despicable, but it is terrible. And I am very hopeful that 440 and we can come together. Like they said, Representative Carpino kind of took the words out of my mouth. I do believe these are some very serious pieces of legislation, and sometimes during a short session, we could hold things off to a longer session and address some of the issues that can be really fleshed out. We know where we're going. The public knows where we're going with these pieces of legislation, understanding there's always little tweaks here and there, but I don't agree with every bill always being a big work in progress coming out of committee. So a no vote doesn't mean it might not be it could be a yes vote on the floor. We'll have to see what they all look like, but I too will be a no today. Thank you.
Thank you, Representative Zupkis. Senator Anwar.
I'll be very quick. I think this is, I respect everybody's perspective who have shared. In the recent past, there's been a situation where a private equity and their presence and their way they have been functioning has threatened the well-being of 500,000 people in the state of Connecticut. 500,000 people. And for us not to intervene and do things that are needed cannot be an option. So in view of that, we have to have this conversation. It is a complex issue no matter when we do it, but it has to be done because we cannot afford to put our residents in the state of Connecticut in a vulnerable position, and that's why it has to be looked at. So just wanted to make that comment.
Representative Denning to be followed by Rep. Welander.
Thank you, Madam Chair. I also agree with Senator Anwar that we need to look at private equity. That private equity comes into the healthcare system in a variety of ways, some in the way that we've seen as disastrous, and some in the way that private medical groups and the way that they're orchestrated and the way that they actually help private partners and physician groups stay in practice and in a financial standing. What we have not addressed, and I feel like we still don't have the reality that hospitals are functioning right now as private equity groups when they collect at all the healthcare systems under their particular name brand and then hike prices up, eliminating competition. And so I agree that we have to take private equity out of the equation, but we're still not addressing the real players in the healthcare system that are bankrupting us. And these are the healthcare conglomerates who, while they supposedly are giving us better quality of scale, they're not. They should do better, and we need to address that issue. Thank you, Madam Chair.
Thank you, Rep. Denning. Rep. Welander.
Thank you, Madam Chair. Just wanted to share that I do think there are some very important parts of this bill that need to be discussed. We need to really start looking at the foundation of some of our healthcare providers. But there are some parts that I have some concerns with. So I am going to vote yes in order to continue these conversations, but really look forward to making sure that we're doing the best by all of our providers and also by the, for the residents of the state. Thank you, Madam Chair.
Thank you, Rep. Welander, for that. And just to acknowledge that what is interesting in the certificate of need discussions is it's very bipartisan in terms of bipartisan support for certain items and bipartisan opposition to other items. And we haven't gotten to consensus yet, which is one of the reasons why we felt it important to keep all of these bills on the table so that the public is aware that these are the items that we are discussing. These are the items that we're putting in the mix. There are some that we're probably closer to consensus on and others that we're not. And so I respect and appreciate the comments that folks have made today. And we certainly know that the certificate of need conversation, while new to us this term in public health this year, specifically at this level and extensive conversation, it will be an ongoing conversation in terms of how we address the financing and funding of healthcare in our state going forward. I do expect that the next legislature will be continuing this conversation as well, given how markets evolve. So seeing and hearing no other comments, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker, Senator Summers,
Senator Summers votes no.
Representative Clarice Detrier,
Representative Clarice Detrier votes no.
Representative Belton,
Belton votes yes.
Representative Berger-Givallo,
Berger-Givallo votes yes.
Representative, I did not see you on screen, I'm sorry.
Berger-Givallo votes yes.
I'll circle back to you, you're still not coming up.
I'm in the room.
You're in the room?
Yes.
Thank you. Senator Cabrera, Representative Carpino,
Carpino votes no.
Representative Cook,
Cook votes yes.
Representative Dauphiné,
Dauphiné votes no.
Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Cabras-DeGraw, Representative Kitt,
Representative Kit votes yes.
Chris DeGraw votes yes.
Thank you. Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes.
Representative Mara,
Representative Mara votes no.
Representative McCarty,
Representative McCarty votes no.
Representative Palm,
Representative Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Welander,
Representative Welander votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. The votes will be held open today until 5 p.m. via Zoom and in room 3000. And thank you for the reminder from our wonderful LCO team to make that announcement. And I will try and make that announcement throughout the meeting today, just to make sure folks know. We'll move on to item number 2 on our agenda. This is Senate Bill number 241, an act concerning the Office of Health Strategies recommendations regarding 340B program transparency. This is a JFS to the floor, LCO 3343. May I have a motion?
So moved.
Moved by Senator Amwer, seconded by Representative Jenga. The 340B is a federal program that basically provides discount drugs to uninsured and assures the provision of discount drugs to uninsured and low-income patients. This bill requires reporting to the Office of Health Strategy of the entities have to report acquisition costs for prescription drugs, payment amount received for the drugs, and payments made to pharmacies. And in addition, there is a requirement to report services that are funded by these 340B savings. And the S language has some technical edit changes. Is there discussion on this item? Senator Gordon and Representative Zupkis. Representative, go ahead, Senator Gordon. Sorry, I saw you both at the same time. Senator Gordon to be followed by Representative Zupkis.
Thank you, Madam Chairwoman. I'll be extremely brief. I just want to say I'm not certain this is even needed. It's a federal program. I have no idea what OHS is really going to do with this, let alone if they even have the bandwidth and the staffing to even handle all of this. And then all the reporting that our hospital systems that have to report a lot are going to now have to report more. So I'm going to be a no on this. Thank you.
Thank you, Senator Gordon. Rep. Zupkis to be followed by Representative Clara DeStitria.
Thank you. Senator Gordon said what I was going to say, but my question is, what is OHS going to do with this information? My first question, I have 2.
Thank you. Thank you for that. I was remiss in not saying that a summary of this information will be posted on the OHS website, so it will be available publicly.
Is it available publicly now through the federal?
I do not believe that this is being reported through the federal program, and this is one of the reasons why we as a state want to add that so that we have some transparency and daylight into how these funds are being spent.
Okay, my second and last question is the reporting that this is asking hospitals to do. Is it the reporting they already have to do for the federal program, or is it in addition to they have to do more reporting for the state?
Thank you, Representative Zupkis. I am not familiar with the specifics of reporting for the federal program and the federal requirements. This, just by design and nature, would be a separate reporting to the state. So even if it was similar information, but my the point of this is to have this specific information in this way and in this form, because we don't actually have access to that right now in a public manner.
Thank you, Madam Chair.
Thank you, Representative Zupkis. Representative Clara DeStitria, to be followed by Senator Elmore.
Thank you, Madam Chair. I believe that this 340B program, and we know, and it's very technical for a lot of people, but at the end of the day, this program is supposed to save uninsured and lower insured people money. And we talk about transparency every single day up here. And I truly believe this will do exactly this, achieve that purpose. We know it's a federal program. We know Connecticut has no say over it, but if we get these entities to report what they're doing, what they're paying with this entire program and post it on their website, it may scare them straight to do the right thing, just in case they're not. So I will be supporting this bill today. Thank you, Madam Chair.
Thank you, Senator Elmore.
Thank you, Madam Co-Chair. I just wanted to make a comment on this topic as well. The cost of medication in the United States is the highest in the world and perhaps in the history of the world. And the cost of healthcare has been gradually increasing, and the cost of insurance has been increasing much faster. But a combination of all of this is resulting in an average individual who is seeking healthcare to not be able to afford it any longer. And this trajectory is not sustainable. There are a number of things that the federal government is trying to do, and then there's things that the state can do. And sometimes having a knowledge and database of the various components of the causes of increased cost is important to start to see what are the areas of opportunity. If people are aware, the federal government for the first time for Medicare has been able to make a list of 10 medications that would be negotiated by the federal government, which is something we never thought would ever see in our lifetime, because it has been such a big issue every time we've been looking at this. This bill is going to look at about 50 medications in the state of Connecticut, most commonly used, and to look at it from the 340B perspective, and then see if what are the opportunities. This is just data gathering right now, but hopefully there will be opportunity to have conversations which are the most frequently used medications, and is there opportunity to communicate with the federal government to make suggestions perhaps about what should be the next list of medications to look at to reduce the cost. And perhaps there's an opportunity to even assess in the state of Connecticut, are there opportunities to reduce the cost for an average individual as well, especially the ones who can't afford. So this is step number one, to try to get a better handle of understanding the various small, big components of the cost of healthcare. Thank you, Madam Chair.
Thank you, Senator Elmore. Senator Summers, to be followed by Rep. Linehan.
Yes, good afternoon. I do not agree with this bill. I think that just even what we've heard with some of the committee members speaking on this bill, it's clear that it is not well understood how the 340B program works. This data collection is, I believe, above and beyond what the states should be doing. This is a federal program, and the individual does not receive the benefit, the entity does. And I think that it misses the mark on where the money is actually being made. And our hospitals that are part of this 340B program, the differential in what they get for a 340B price versus the market price, they are supposed to use to deliver healthcare. I can tell you that a hospital in my area uses it to run a maternal health clinic. So they are using it to benefit the people of the state of Connecticut. This is really not about drug pricing. It's about where the differential in the pricing goes and how it's used to help deliver healthcare at a lower cost. And, developing a maternal clinic is one of the ways. So I don't agree with this bill. I'm going to be voting no. I don't think that OHS has the bandwidth to handle it. I'm concerned about what they're going to be doing with the information. It's another additional request of us on CHA to deliver this information. I think we could have just asked them kindly to please report how they're using the money that they receive from the 340B program without having to put this in legislation. So I will be a no today. Thank you.
Thank you, Senator Summers. Representative Linehan.
Thank you, Madam Chair. My question is actually regarding how the data is going to be compiled. So when the data comes in, is it just going to be strict numbers Or will there also be some sort of explanation on how to read that because it is public facing? And that's the first of my two questions.
Thank you very much, Representative Linehan. OHS will be placing a summary of the information. So I think the idea is to simply put it out there, not necessarily to make judgment on it, so to speak, but simply to provide it for us in a form that is summary form and digestible.
I think one of the concerns is what is digestible when we're talking about the general public. I think those of us on this committee who have been doing this for a while may have a different level of expertise than the general public would. And a lot of us who've been on this committee don't even have any of the expertise and would have trouble with that. So if there could be thought going into that, I don't think it needs to be in the bill itself, but if they could keep that in mind. And secondly, the push to federally to change the 340B program also has a lot to do with pharmacy benefit managers. And it has to do with how they are taking advantage and contract pharmacies are taking advantage in order to make a profit off of what is supposed to be savings. So I'm wondering if when the bill comes to the floor, might there be any consideration to have the data specifically show that? And I believe we would then have to include not just information from hospitals, but also from contract pharmacies.
Thank you, Representative Linehan. Your points are well taken, and I think we certainly can have that and should have those conversations with the Office of Health Strategy. And in terms of the presentation of the information, many of you hear me say often the 4th grade level, which is really allowing for transparency and translation, not just for us here in the building, but for members of the public as well. So thank you for that, Rep. Linehan.
Thank you.
Seeing and hearing no further discussion, Madam Administrator. Oh, did I miss someone? Okay. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Yes.
Representative McCarthy-Vahey,
Rep. McCarthy-Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker, Senator Summers,
Summers votes no.
Representative Clarice Dietrich,
Clarice Dietrich votes yes.
Representative Belton,
Belton votes yes. Belton votes yes.
thank you. Representative Berger Givallo,
Berger Givallo votes yes from the room.
Senator Cabrera, Representative Carpino,
No.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Jengo,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Cavers DeGraw,
Cavers DeGraw votes
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes. Thank you.
Representative Mara,
Representative Mara votes no.
Representative McCarthy,
Representative McCarty votes no.
Representative Palm,
Representative Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slav, Representative Steinberg,
Representative Steinberg votes yes.
Representative Terciak, Representative Wielander,
Representative Welander votes yes.
Representative Zupkis,
Representative Zupkus votes no.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. And the votes again will be held open today until 5 p.m. on Zoom and in room 3000. Moving on to item number 3 on our agenda, Senate Bill 242, an act concerning the Office of Health Strategies recommendations regarding the all-payer claims database. This is a JFS to the floor, LCO number 3346. May I have a motion?
So moved.
Moved by Senator Anwar, seconded by Representative Denning. This bill requires the all-payer claims database to actually include non-claims data, and for the all-payer claims database advisory committee to develop recommendations on those reporting requirements. It removes a provision excusing hospitals from meeting their community benefits requirements due to access issues, and the S language changes dates, and it adds section 3 with requirements for those reporting recommendations to the APCD as opposed to the ADPC, which is the Alcohol and Drug Policy Council. Just alphabet soup fun for all of you. Is there discussion on this item? Senator Anwar, you want to say a word?
Thank you, Madam Co-Chair. From a broader perspective, all the not-for-profit healthcare systems are supposed to have community benefits that they would give. And it's a mechanism, and there's no hard and fast formula that's out there that determines what that amount is going to be. But it is important to at least have some of that information that they would need. But while they do require some of that information, it should not be dependent upon getting all the data. In other words, there's a law that requires them to be able to give for community benefits. And at times, many or some healthcare systems may make an argument that they cannot contribute to the community benefit till they have this information. So this bill would clarify that component and would help the community get the benefits that they're supposed to get. So that's the broader perspective.
Thank you, Senator Anwar. Senator Gordon.
Thank you, Madam Chairwoman. And this, to me, when we talk about expanding what type of information is going to be given to OHS, again, I'm going to say what I said previously is I don't think OHS has the capability or the bandwidth or the staffing to do this. And why are we looking to expand more what hospitals have to report? It's unclear what's going to be used with this data. And unless one can really clearly and specifically in the bill state that, then I can't support this. It's just another data reporting that I don't think state government is going to really do anything with or has the capability to do anything with. So I'll be a no. Thank you.
Thank you, Senator Gordon. Representative Kennedy.
Thank you, Madam Chair. On this particular bill, I will be a yes to get it out of committee. I will say I'm a little disappointed in some of the language. The federal exemptions were not included in it, but it seems as though this again is a work in progress, but to get it out of committee, I will be a yes today. Thank you for your time. Thank you, Madam Chair.
Thank you, Rep. Kennedy, and I welcome ongoing conversation with you about that. Are there any other comments or questions? Senator Anwar for the second time?
Yes. Just to clarify, this is not expanding any powers that are there, and then this information will be available for the community benefit April 1st of this year. Just wondering about it.
Thank you. Thank you for the clarification on that. Representative Kennedy for the second time?
Thank you for the second time since I was looking at the next bill. So it is the next bill. I apologize. So I'll retract that and save that for item number 4. We are on item number 3, SB 242. Thank you, Madam Chair.
Yes, thank you, Representative Kennedy. And as you're getting ahead of yourself, which is fine with me, I support that. But we will first make sure there is no further comment or question on this bill. And seeing none, Madam Administrator, would you kindly call the roll on item number 3?
Senator Anwar,
Yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Kushner, are you in the room?
I'm on.
Okay, I see you now. I didn't see you before. Thank you.
Of course.
Senator Marks, Representative Parker, Senator Summers, Representative Clarice Detrier,
Clarice Detrier votes no.
Representative Belton,
Belton votes yes.
Representative Belton, are you in the room or are you on Zoom?
I'm on Zoom.
Okay, I see you now. Thank you. Representative Burger Givallo,
Burger Javala votes yes.
Senator Cabrera, Representative Carpino,
Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné.
Dauphiné votes no.
Thank you. Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Cavers DeGraw,
Votes yes.
Representative Kitt,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no.
Representative Linehan,
Linehan votes yes.
Representative Linehan, I did not see you on screen.
Linehan votes yes.
Thank you.
Thank you.
Representative Morrow,
Representative Mara votes no.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Representative Palm votes yes.
thank you. Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes no.
Representative Ryan,
Votes yes.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis.
Rep. Zupkis votes no.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. Again, votes will be held open until 5 p.m. today. Now we're going on to item number 4, which is House Bill number 5200. This is an act concerning healthcare accessibility for persons with a disability. This is a JF to the floor. May I have a motion?
So moved. Oh, sorry.
May I have a motion? Moved by Representative D'Amico, seconded by Senator Anwar.
Yes.
Thank you. And to the good representatives' comments on the earlier bill, this is JF language. We heard extensively in testimony requests from the community advocating on behalf of and for this bill that there are requests for extensive S language amendments. We, as a screening team, discussed that they are extensive changes, and we remain in negotiation around the best way to move forward that's viable for us. The idea behind this bill, and I'll certainly let Representative D'Amico speak to this bill as well, and he can share his efforts. And I want to thank Rep. D'Amico for being such a champion, Senator Anwar for your work, talking with the members of the community, which is, as we heard during testimony, to assure that the folks who are in the disability community have the ability to be weighed at their appointments, to receive the services and medical care that they desperately need. And I think we all share the desire to be able to move forward and provide improved access. We continue to struggle with the exact bill language that will help us to get there, and do so in a way that will help. So I'm going to turn it over first to Representative Claritas Tetria, and then to Senator Anwar. Would you like to comment first? And then, okay, Rep. Claritas Tetria.
Thank you,
please.
Madam Chair. And I do agree that we need to address this issue. I think it's very important. And I know this, I wish we did a little bit more work before we got to today, but this is a bill that I truly think is very important to work on. I will be supporting it out of committee, and I'm hoping and expecting to make the changes that we need to get this bill to where it needs to be. Thank you, Madam Chair.
Thank you for that, Rep. Claritas Tetria. And I will add that this language will need to be changed, just very clearly, so that that is on the record, and that, you know, whether you're in favor of or against, that the language as we see it today will need to be changed, and we will be working together. I'll go next to Representative D'Amico. Would you like to make any comments?
Sure. Thank you, Madam Chair. I just wanted to thank you and Senator Anwar and the ranking members and everyone who has been so supportive of this effort. As you know, I've been trying to make some progress in this area for several years. I am in agreement. This is not the right language. I think I made that clear in private conversations. I think I made it clear all along. We do have language that I think would get us to the point where we can move forward here. And I've shared that language with the leadership of the committee. The language provides exemptions. The language comes from the federal guidelines that accompany the technical standards that were adopted 7 years ago by the U.S. Access Board. So in response to the concerns that were expressed at the public hearing, that we can't possibly know what the federal standards are, we do know what the federal standards are. They were adopted 7 years ago by the U.S. Access Board. We just the problem is, how do we make them relevant to Connecticut? So the substitute language that was provided by the Citizens Coalition for Equal Access, who came and testified here a couple of weeks ago, this language provides the exemptions that I think will satisfy the concerns of people that this is going to be too costly, it's going to be too burdensome. It allows for exemptions for entities that find it to be a burdensome change. So I appreciate the fact that leadership is going to be looking at the substitute language that's been offered. The current language in front of us is not the language, but we will get there. And I would really appreciate and encourage my fellow committee members to move this bill forward to address a real serious deficiency in our healthcare system when it comes to providing access to people with disabilities. So I thank you for the opportunity, Madam Chair.
Thank you very much, Representative D'Amico. And I will say, we have a number of people who want to speak on this. I think we were all very moved by the testimony, very effective testimony and powerful testimony that we heard. Senator Anwar, to be followed by Representative Zupkis, to be followed by Representative Kitt.
Thank you, Madam Chair. I just wanted to make a couple of comments. Wanted to thank you, Madam Chair, for your leadership, and Representative D'Amico for your commitment and your leadership. But the advocates and their testimonies were very moving, and we don't want them to have to come here just to testify for their bill. We want them to come here and visit us, but we should be able to pass a bill. During the short session, you'll probably see a trend where we are we are not partisan on many of the bills. You will see people vote from both sides on issues. Our real challenge is twofold. One is the time limit and timeline that we have to follow. The second thing is the budget has pretty much been set. And when we have a bill which is going to have a fiscal note, there's a risk that that bill will not make it through the committees and the appropriation committee. And that's why we are looking at how can we word this bill in such a manner that the financial expectation that we hope that we could take care of urgently would not necessarily harm the bill altogether. And that's what the conversation is, and that requires many difficult discussions with the people outside of this committee as well. And I think that's the reason that the language is not in the final version that it is in right now. I can tell you that this is a priority bill for Representative Kristen McCarthy-Vahey and me, and then many of the people who have spoken to us from both sides of the aisle. And it's clearly something that has touched each and every one of us. We do want to be able to do something that was going to be meaningful and would create a framework that we can build on in future. That's how we look at this, and absolutely accurate that the current language does not do justice. So again, on the record, both of us are stating that this is work in progress that will require us to continue that work. Thank you, Madam Co-Chair.
Thank you, Senator Anwar. Representative Zupkis to be followed by Representative Kitt.
Thank you, Madam Chair. My question, I do think this is important for sure. Everybody should have access to quality and dignity healthcare. I truly believe that. My question is for the committee, our deadline is April 1st. So why are we not taking a little extra time to do it right now and put the wording in now versus what has been happening with a lot of these bills, passing it out to work on later?
Thank you, Representative Zupkis. I think the decision was made for a lot of different reasons, and I respect that perspective and understand. We certainly are finishing well ahead of our deadline, which is different than normal. And I think there are a number of reasons for that, but I understand the concern. And I do think this, as Senator Anwar referenced, there are quite a few bills that will definitely require corralling multiple stakeholders. And I may speak to that a little bit at the end of the meeting as well to help answer that question. But I appreciate what you're saying. Thank you for your comments. Representative Kitt.
Thank you. I just want to say thank you to Representative D'Amico for being such a champion on this issue and for the chairs for being behind this bill. I come from a disabilities community, and this is an issue that has been facing many of my friends and colleagues for years, not being able to get regular health care that each and every one of us deserves and needs to live healthy lives. So I know the language is still a work in progress, but I urge everyone around the table here to support it, because we cannot go another year and having these people suffer and in a very undignified way. So I encourage all of you to support this bill. Thank you.
Thank you very much, Representative Kitt. Representative D'Amico for the second time. Oh, excuse me. You know what? Before Representative D'Amico, forgive me, I missed that there was a hand both here and on Zoom. So I'm going to go to folks who have not had the chance to speak first. So Representative Dauphiné to be followed by Senator Gordon.
Thank you, Madam Chair, and thank you everyone for working on this bill. I do agree that we need to do something, but I do like to see exactly what it lands in the finality of the bill before I vote on it. So I will be a no today, but I do look forward to some constructive changes that you make going forward. Thank you, Madam Chair.
Thank you, Representative Dauphiné. Senator Gordon.
Thank you, Madam Chairwoman. And in general, I don't like voting on JF bills when we know there are things we could be doing to make the bills better. And we, as Representative Zupka said, we have ample time to deal with some of these things. But on the other hand, this is an important bill. I think I definitely want to see without exception that what gets put in is, as we've heard testimony on, the federal exemptions that are listed. That's an extremely important thing. And even though I'll vote to get this bill out of committee, I do advocate very strongly, we really need to make certain that wording is in. And also understand that when we look at the American with Disabilities Act, that even has wording in there about reasonable accommodations. And I think if we can put those exceptions in, that keeps true to the intent in the meeting of the ADA, and also those federal rules. There's the short cliff notes that I've read, then there's the longer massive document that I've read through. So even though I'm concerned about the process this committee is following on this bill, I will work to see what we can do to get this bill out, and certainly work to see what we can do to get this bill passed in the House, passed in the Senate. And I want to thank all of those who testified from the public to continue to highlight this. It's been going on long enough, some of these issues, and we really need to do something about it. Let's see what we can do to do it the right way with good wording in the bill. And a shout out to my colleague, Rep. D'Amico, for your leadership on this. Thank you.
Thank you for that, Senator Gordon. Representative Reddington Hughes.
Oh, and I would echo the same concerns, but also look at things as something that is shameful that we have let this go this long. So I do have concerns with this, the way that things are right now. We'll have to see how things are written into it, because I do believe that, federal standards are already there. It's a question of whether people enforce them. And I don't know why that's not happening. I think that this is something that is a much larger problem than what we're seeing. This is just the tip of the iceberg, but I'm glad that it's getting out there, because I think that, it's been a long time. This is something that has happened in the Americans with Disabilities Act, was something that occurred during most of our lifetimes. And it's something that we could really make a difference in, for the next generations to come. Thank you.
Thank you for that, Representative Reddington Hughes. Representative D'Amico for the second time.
Yes, I'll be brief, Madam Chair. I just want to say, as you do, I take the concerns of our colleagues to heart. I also appreciate all the kind words from my colleagues, and I just wanted to especially express to Representative Kitt how gratifying it is to go from being a pain in the neck to being a champion. Thank you very much.
Oh, thank you. We very much appreciate you, Representative D'Amico. We truly do. And all of the members of the committee, truly. Seeing and hearing no other, Senator Anwar for the second time.
I'm sorry, I just felt it's worthy to say, this bill is going to come out of committee. And then for some of my colleagues who have shared their concerns on the record, I respect your concerns, but perhaps this is one bill that we can all find it within ourselves to say yes to today unanimously, to make a statement. I would just urge you that. I know you have shared your concerns and you've made them public. I just wanted to throw that out there for the people who came with so much difficulty to say, and we can find one reason not to say yes, but 100 reasons to say yes. So consider that option, please. I won't say that for most bills, but this is one I would suggest. Thank you.
Thank you, Senator Anwar. With that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker, Senator Summers, Representative Tardis Detria,
Claire Destetria votes yes.
Representative Belton,
Belton votes yes.
Representative Belton, I did not see you on screen, please. I'm sorry.
Belton votes yes. Do you see me now?
Yes, ma'am. Thank you.
Okay.
Representative Burger Givallo, Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Representative Cavers DeGraw,
Votes yes.
Representative Kidd,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes yes.
Representative Linehan,
Representative Linehan votes yes.
Representative Morrow, Representative McCarty,
Representative McCarty votes yes.
Representative Palm,
Representative Palm votes yes.
Representative Perello,
Perillo votes yes.
Representative Rader,
Representative Rader votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
Reddington Hughes votes yes.
Representative Ryan,
Votes yes.
Senator Slapp, Representative Steinberg, Representative Tersiak, Representative Wielander,
Representative Welander votes yes.
Representative Zupkis,
Rep. Zupkis votes yes, but I do not like the process.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. Moving on to item number 5. Actually, before we do, I just want to acknowledge that we have a group of students from UConn here with us today, and it's really wonderful to see all of these young people here who are engaging in the process. And yes, welcome. We welcome you. Yes, thank you. So we will move on to item number 5, which is House Bill number 5290, an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This is a JFS to the floor, LCO number 3275. May I have a motion? Oh, excuse me, 3278. I'm going to repeat that again. This is LCO number 3278. May I have a motion?
So moved.
Moved by Senator Amwer. Is there a second? Seconded by Representative Kitt. Thank you for the correction. Again, our wonderful LCO team to the rescue. This bill, similar to the bill that we discussed first on the agenda, is a group of revisions, this time from the department, coming from the Department of Public Health. It does quite a few things, and I will go through a number of these items that the bill contains. It does create a process for children born outside of a hospital or institution for their parents to request a birth certificate before the child's first birthday. And it gives a person, legal custodian, the right to access that birth or death certificate. It clarifies notice requirements related to projects that could impact land within an aquifer protection area or watershed of a water company. It broadens the qualification criteria for a governor appointee to the School-Based Health Center Advisory Committee. It requires DPH to notify a DCP rather than consult with them related to variances for food code requirements. It requires the DPH licensed professionals, all of them, to renew licenses through the DPH's online system and to pay renewal fees online. It removes a requirement for witness signature on the form before a patient may participate in the medical orders for life-sustaining treatment. It streamlines the process for dentists who are seeking a dental sedation or general anesthesia permit. We heard from a number of the dentists during testimony that's for multiple locations after they've been approved for one location. It codifies existing practice by authorizing the Department of Public Health to issue certificates for water treatment plants or water distribution system operators and training. It defines cremation as including alkaline hydrolysis. It requires EMS personnel trained in administering epinephrine to do so only if the medication is available, and provides that emergency medical responders training in this regard can be limited to methods that are within their scope. It clarifies and revises certain provisions on private well testing and adds the statutory definition of asbestos containing materials. It renames, and this is simply a name change. I would like to underscore and reiterate this. It is simply a name change from sanitarian to environmental health specialist. It makes some technical changes. And finally, and I will note, actually, this is S language. There's a new section that allows birth centers to become licensed while in the process of applying for accreditation if they meet certain requirements. And this was the necessary changes from what we did in last year's law. I will add one other S language clarification. The language in sections 1 and 2, and we had conversation about this during our hearing related to birth certificates and legal guardians, and it clarifies language there. It is an extensive bill, one that we also will continue to negotiate with the Department of Public Health. When I say we, I mean our chairs and ranking members together. And with that, Representative Clara DeStitria.
Thank you, Madam Chair. Can you just clarify for everybody the reason why we're adding the parent or legal guardian language for the birth certificates?
I
The
think
probate court, that the whole issue with the probate court, why we're doing that?
so. This process is a change that would allow those who previously, those who had children born outside of a hospital or institution had to wait until after the first year of birth to be able to access that birth certificate. So this is a process that would allow them to do so before that first year. And we did in the S language assure that it was a legal guardian, just to make sure that we were not confused about that. Thank you. Senator Gordon.
Thank you, Madam Chairwoman. And I understand this is a big bill. There's certain provisions in it that I like, including an item supported by the Connecticut State Dental Association. But there's also concerns that were raised by some of the local health departments. And I think we need to keep that in mind. Their concerns, just not about a previous law that affected Section 19A37 regarding data about water wells, especially in residences in parts of the state, such as my part of the state, that unfortunately have an expanding salt contamination, which is a real issue. But also concerns they raised about this proposed bill. And I think we do need to take that into account. And so I would hope that if there's further work on this, and I look forward then to seeing what we can do with that work, their concerns, are further addressed. And so even though there are parts of this bill that I like, I think there's some parts that I have concerns about, and also the concerns raised by the local health department. So I just wanted to highlight that part. Thank you.
Thank you, Senator Gordon. Are there other comments or questions? Representative Kennedy.
Thank you, Madam Chair. So going through testimony and everything, and this is a very large bill, as you stated, and probably a bill that I would imagine is still a work in progress. So that said, I don't see where we took into consideration some of the changes proposed by the probate court administrator when she testified. So I hope we can look back at that and look at that again. they were pretty, there were some of them that just I don't see in this bill, and I'd like to see us look at that. And the second thing is, and respectfully, I know you said that it's just a name change from registered sanitarian to a registered environmental health specialist. However, we did have testimony that states that they're two very different things. And the training and certifications, one's a degree and one's just a certification. The NEHA exam is the credentials required to sit for an NEHA, sorry, excuse me, are far less stringent than the Connecticut certification and licensure. It's not simply an interchanging of names, and I'm going based on the testimony. And my other concern with that is the impact on current statutes. Adopting this name can contradict our current existing laws and regulations. So I do have great concerns with that, and I hope we'll look at that and address that when it comes to the floor. So today I will be a no. To me, these are fairly glaring, and I think they should just be looked at. So thank you very much, Madam Chair.
Thank you, Representative Kennedy. Excuse me, with respect to the probate court, certainly I'm happy to engage in further conversation. I think we did make some changes, but we can talk more about if there are others that need to occur. With respect to the environmental health specialist, unlike what we will be talking about in the next bill, there's not a specific certification group or exam necessarily discussed. What I have asked of both the Department of Public Health and our LCO attorneys is, would there, as a result of the changes that we are making in this bill, be any changes required of those who are performing these duties currently under the sanitarian name? And the answer I've been given is no. And so as a result, we actually as a group have moved forward with this language. I think there sometimes is difficulty with nomenclature, but in terms of I want the committee to know and have clarity that we are not asking people to achieve a different kind of certification. We're not asking them to perform any other duties that are other than what we have in statute. We're not making any substantive changes from what I understand, but I understand that there are still concerns, and I think it's worth conversation, as we always continue to do, so that we can have assurance and that everyone can make sure we're on the same page about that. Representative
And
Kennedy.
absolutely, I agree with you, Madam Chair, and it's the unintended consequences certainly that we want to make sure we avoid in this case. And it doesn't change the role of our sanitarians and our local public health departments. So thank you very much, Madam Chair.
Thank you for those comments. I appreciate the opportunity to bring out that conversation. I think it's been one, you are not alone in having that question. So I appreciate you bringing that before us. Seeing and hearing no further comment. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker,
Representative Parker votes yes.
Senator Summers, Representative Tiredis Dietrich,
Claritas Dietrich votes no.
Representative Belton,
Representative Belton votes yes.
Representative Berger-Giballo, Senator Cabrera, Representative Carpino, Representative Cook,
Representative Cook votes yes.
Representative Dauphiné, Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no.
Representative Cavros DeGraw,
Cavros DeGraw votes yes.
Representative Kit,
Kit votes yes.
Representative Kennedy,
Kennedy votes no to flag.
Representative Linehan,
Linehan votes yes.
Representative Mara, Representative McCarty,
Representative McCarty votes yes.
Representative Palm,
Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Representative Reddington Hughes votes no.
Representative Ryan,
Representative Ryan votes yes.
Senator Slabb, Representative Steinberg,
Representative Steinberg votes yes.
Representative Tersiak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis,
No.
Representative Carpino.
No.
Thank you. Thank you, Madam Chair.
Thank you very much, Madam Administrator. And I'll remind folks that votes will be held open today until 5 p.m. And also just note that, as is often the case here, people are in and out of meetings. A number of committees are voting. So I recognize that folks are having to juggle different committees, and just for those watching to know that that is the case. So with that, we will move on to item number 6 on our agenda, which is House Bill 5318. This is an act requiring the licensure of lactation consultants. This is a JFS to the floor, LCO 3222. May I have a motion?
So moved.
Moved by Representative Kit. Is there a second?
Second.
Seconded by Senator Anwar. The bill before us is the product of a working group over the past year that was co-chaired by our MAPOC Women and Children Subcommittee leaders. And thanks to Amy Gagliardi and Rep. Leeper for their work on that and those who participated. This bill will require, beginning in October of 2027, that the Department of Public Health will create a licensure program for lactation consultants. And to receive a license, an application would have a certification or credential from the International Board of Lactation Consultant Examiners. And the S language, which we did have some changes that occurred in the S language. First, some clarification language that the licensure is for folks who are doing this work for compensation, which is something that is generally accepted and understood, but clarified here. It also, the S language also notes that those who are providing these services through WIC, the community health workers, and any other federal nutrition program who can do this now can continue to provide those services in that way. There were changes made to the initial application and renewal fees, which I know was something that we heard about from a number of folks in testimony, from $315 to $200 for the original application fee, and from $90 to $100 for the renewal fee. And then there were some other additions of sections to make technical references to the Department of Public Health statutes. And I will entertain questions on this, or I see Representative Linehan. Please proceed, madam.
Thank you very much, Madam Chair. You know, I had taken on this a few years ago. Actually, I think it was my first year in the legislature, and I'm on year 8 now. So I want to just put some clarifications on the record, if you can help me. So a lactation consultant, a lactation specialist, an IBCLC, you know, there's all different levels of people who can be in the lactation business, so to speak. Does this actually combine all of those into one, or does it keep levels?
Thank you very much for that question, Representative Linehan. No, it does not. It recognizes that is often the case in a number of care team type of situations. There are providers who provide services in different ways and at different levels of education and training. What we are seeking to do is to provide a licensure pathway for those who receive the certification through the IBCLE, as I mentioned, the International Board of Lactation Consultant Examiners. And they are required to have a college degree and go through extensive training. There are other counselors and peer support educators who will provide support and would, continue to folks who would have a certification, perhaps a weekend program. So we are not including those other folks in this bill. This would simply be similar to, for example, a licensed clinical social worker who would go through the examination process and the licensure process and receive that. So that's hopefully clarifying to you. Thank you.
It is clarifying. And if I can just follow up rather quickly, I think one of the concerns is always about the public understanding the difference between someone who took a weekend course and someone who has a college degree. So with this licensure, will there be any information on the Department of Public Health's website letting everyone know, the levels and what they can expect? Because as a mom who nursed 3 children and had trouble nursing my second, but not my first, there was a lot of confusion as to who I can hire, who is going to be covered under insurance, and who is actually certified and who took a course in it. And so you can get some advice that doesn't work for you. And so dependent upon how bad the situation is and how much trouble you're having, you should know what level of person you're going to, and if there is someone with greater experience, to reach out to them either first or subsequently. So I just want to make sure that the information available to the public is going to be part of this legislation in order to let people know what they're getting.
Thank you for that question, Representative Linehan. The bill itself doesn't necessarily contemplate how the Department of Public Health would put information on their website. However, as we heard earlier in the revisions bill, which the hope is that folks would be applying and renewing all online. That's the goal of the legislation. So the only licensure process and information would be available to those, and the only folks who could actually call themselves IBCLCs, International Board Certified Lactation Consultants, and the nomenclature is important there, would be those folks who have that certification. But we can certainly have further conversation about how that is. I think you're right that this can be confusing for folks. And frankly, breastfeeding is something that we have not spent a lot of time talking about as a legislative body, other than folks like you and Representative Leeper. And there is a lot of learning to do about how the various providers help give that support. And it is different to have more, peer support, for example, for folks who don't necessarily who are breastfeeding and don't necessarily have incredible difficulty versus a complex care situation, for example, with a baby born in the NICU who needs much more clinical support and more education, training, and background. So I'm not sure if I fully answered your question, Representative Linehan, but what I will say is I'm happy to have further conversation with you and others about that kind of communication.
Thank you very much, Madam Chair.
Representative Reddington Hughes.
Thank you, Madam Chair. I'm just a little confused because in the bill, it says that the applicant for licensure is not necessarily somebody that is IBCLC, that it is someone who is entitled to perform similar services. So that's not what I'm hearing. I mean, if that is the case, then the wording in this is incorrect.
Representative, are you referring to the S language, which I was referencing earlier in terms of those who are able to continue to provide services?
this was the line 55. An applicant for licensure. Maybe I'm looking at the wrong thing.
Forgive me if I just took a moment to check in, and if you could just repeat for me, if you would.
Sure. It says an applicant for licensure by endorsement shall present evidence satisfactory to the commissioner that the applicant is licensed or certified as a lactation consultant or as a person entitled to perform similar services under a different designation. So that doesn't tell me that they are definitely an IBCLC.
So just so that we're on the
Mhm.
same page,
Yeah.
literally, looking at S language in LCO 3222. So we have S language for this bill, and there were some changes that were made actually, and I believe that addresses your concern and clarifies.
Okay, thank you.
Sure, and I appreciate you asking that question and raising it, because that was one of the changes that were made in the S language. So thank you for that.
And the reason I asked that is because, I did meet with IBCLC, folks that were not happy with this bill at all. And they felt just like what Representative Linehan had addressed, was that this would further confuse the public, so that the people that had spent all of this time and energy getting their degrees and putting in all these extra hours to be a consultant would really be devalued.
Thank you for that comment. And I will note that we certainly did hear testimony, and we've heard from a couple of people who are consultants who have gone through the process, who are opposed. We've also heard from many who are in favor. There isn't a formal organized group in Connecticut that I am aware of. I believe there is a Facebook group of the IBCLCs who speaks with one another. Again, through that process of the working group, there were a number of public forums and opportunities for people to weigh in. And it was at that point that, we've heard from folks. We have seen evidence and heard that in other states where licensure has been started, that there were actually an increase in the number of IBCLCs. And I should also probably take this opportunity to note, one of the main driving goals of this legislation is to then allow for Medicaid reimbursement for these folks who have that level of certification, which what it does is helps us to address our issues around inequality with maternal and infant outcomes, particularly for our Black and brown mothers. And so we're hoping, and what we've heard from some of those IBCLCs with this certification, that they would like to be able to serve a broader community, including the Medicaid population, but that financially it's difficult for them to do so with no ability to receive reimbursement. Another interesting fact about the ability to do licensure, we then open up a pathway to Pell Grants for those who are wanting to pursue this career pathway, which I think is a compelling argument. But you are correct, there is not unanimous consensus on this, but it's our belief that this pathway will actually provide better services, especially for those who are most in need. And I know Representative Wielander, Representative, I'm sorry, will
Yeah.
you finish?
No, I
please?
would
You have
just
the
like to
floor.
add that, the thing that was a bit remiss was that they were not included in the working group. So I think that, when you were saying as far as the organization itself and having something that was, Connecticut based, it's an international organization. So I think that it was very difficult for them to organize the same as the CLCs, because the CLCs are a whole different story where they are very well organized. So, I think that the absence of their profession in the working group, when this has something directly to do with their profession, was perhaps a mistake. Thank you.
Thank you, Representative. I will say, I appreciate the clarification between the two groups. There were members of the working group who are IBCLCs. There were actually a couple of folks, not all, who have different perspectives were included, and I appreciate what you're saying about that. Thank you for the conversation. I believe Representative Wielander.
Thank you, Madam Chair. I'm going to touch upon, I think, a couple of the same points. I just wanted to confirm that the updated language is based off of the working group that met for almost a year. Is that correct?
Yes, thank you. Those were the recommendations that came from that group, which in fact, actually, I've clarified, had 5 IBCLCs who were members of that group.
Oh, that's wonderful to know. Thank you. And again, the updated language, which is different than what we heard in the public hearing, was agreed upon by the broad based working group.
Those were the recommendations that came out of the group, and certainly not every perspective was represented in the group, but there was a lengthy process and there were opportunities for input, and certainly, again, opportunities through the public hearing process. We continue to receive emails and have conversations with one another here. So this, as always, it's an ongoing conversation until those bills get signed.
Absolutely. Thank you so much for that. And I'm just very happy to hear that we're having these conversations. I think we don't acknowledge how difficult it can be to be a nursing mother sometimes, and how it's just expected to be natural and come to you and there aren't any issues. And to, as someone who did nurse each of my 3 children, it was not easy sometimes. And I would have loved to have had a little bit more support in some moments. So I'm really grateful that we are doing this bill and having this conversation, and hopefully we can make this type of support available to more women across the state. So thank you very much, Madam Chair.
Thank you so much. Breastfeeding certainly impacts both maternal and child outcomes, and it's also an economic issue. I've shared many times over the years that my husband was in search of a job when I was pregnant with our first child, and so cloth diapers and breastfeeding were part of our economic reality. So I think it's important to remember that as well. Representative Dauphiné, to be followed by Representative Gilchrist.
Thank you, Madam Chair. Thank you for the opportunity to say a few words. I have heard from many individuals, and I think also from the particular person that Representative Reddington Hughes heard from as well, who were very opposed to this licensure, and who have also shared that, like doulas, there is a pathway for coverage through Medicaid, Medicare that doesn't have to include licensure. I think it's not necessary to expand this opportunity for many people. So I will be a no today on this bill. Thank you.
Thank you, Representative. Representative Gilchrist.
Thank you, Madam Chair. Just wanted to speak in support of this proposal and thank Representative Leeper and Amy Gagliardi, who have spent a great deal of time having these conversations. In no way does this legislation prevent other folks from providing support. As we've discussed, there are different levels, for lack of a better word, for breastfeeding support. And this will give an opportunity for the IBCLCs to be able to get Medicaid reimbursement. I think what's important to note in the concerns about licensure is that this proposal reflects the national standards that the IBCLCs already adhere to. And so there wouldn't be any additional hoops to jump through. Thank you, Madam Chair.
Thank you very much, Representative Gilchrist. Seeing and hearing no further Representative Kennedy, please.
It's Friday and it's a long day. Is the CON necessary for this change?
Oh gosh, that's hysterical. Oh my gosh, I really, really appreciate that. Sometimes I'm a little slow on the uptake. Oh my, I did. And we all did. We appreciate you. Thank you. Seeing and hearing no other discussion, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker,
Representative Parker votes yes.
Senator Summers, Representative Tardis Dethier,
Representative Claire Testaccia votes no to flag.
Representative Belton,
Representative Belton votes yes.
Representative Burger Givallo,
Representative Burger Gervalo votes yes.
Senator Cabrera, Representative Carpino,
No.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Rep. Dauphiné votes no.
Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes no.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes no to flag.
Representative Cavras DeGraw,
Cavros DeGraw votes yes.
Representative Kitt,
Kidd votes yes.
Representative Kennedy,
Kennedy votes no to flag, and I look for more discussion.
Representative Linehan,
Linehan votes yes.
Representative Morrow, Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Representative Palm votes yes.
Representative Perello,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes votes no to flag.
Representative Ryan,
Votes yes.
Senator Slapp, Representative Steinberg, Representative Tersiak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you very much, Madam Administrator. With that, we will move on to page 2 of our agenda. Item number 7, House Bill number 5319. This is an act requiring a plan concerning private equity firms acquiring or holding an ownership interest in healthcare facilities. This is a JF to the floor. May I have a motion?
So move.
Moved by Senator Anwar. Senator Gordon, do you want to make a second on this bill? I'm putting- Second by Senator Gordon. I just want to acknowledge this bill, which actually Senator Gordon brought forward. So we work together in the House and the Senate, don't we? And this basically is addressing the issue that we were talking about earlier today, which is the use of private equity firms and ownership in healthcares and asking for a plan. So I'm going to actually give Senator Gordon a moment to say a word. Senator Gordon.
Well, thank you very much, Madam Chairwoman, and I'm glad that this has come up, and I appreciate having had the opportunity to work with you and to work with your co-chair, Senator Anwar, on this. I know we've heard concerns from some people about how expansive could proposed legislation be looking at private equity firms, including from those who are in private practice. We heard from them. But certainly one of the big concerns, and we've heard this during public hearing, is what's happening with our hospital systems. For example, we hear about the massive problem created by Prospect, and we're well aware of what's happening over the border in Massachusetts with Steward, and the fact that likely the state government there is going to have to step in and do something. So I think it really behooves us to get ahead of the curve as much as we can, since already we're facing problems in this state. And it's just not problems with private equity coming in and buying a hospital and dragging out all the money that they can. This really gets down to patient care, and patient care for all of our constituents. So I think this bill can move things in a good direction so we can, number one, better understand what's going on, and number two, work on a reasonable and realistic plan for how do we address this, just not waiting to be reactive, but what can we do proactively? So I do support the bill. I look forward to getting out of committee. Hopefully we can get it passed this legislative session. Then we can see what we can do working with the parties on trying to craft up some reasonable plan. And I expect this is going to be an issue we'll have to deal with again next legislative session. Absolutely. So thank you very much.
Thank you, Senator Gordon. Next legislative session, I believe for many years to come. Senator Anwar.
Thank you, Madam Co-Chair. I just wanted to mention this would be one of the yet another bills trying to address the private equity and how they have harmed, at least in the hospital setting, the patient's well-being. So we have multiple different bills that are coming out of the committee to try and get everybody together to look at the best solutions forward. And this is one of the bills too. So I look forward to supporting this to continue the conversation too, Madam Co-Chair. Thank you.
Thank you, Senator Anwar. Seeing and hearing no, excuse me, no other discussion. Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehy,
McCarthy Vehy votes yes.
Senator Kushner, Senator Marks, Representative Parker,
Representative Parker votes yes.
Senator Summers, Representative Clarice Dietrich,
Clarice Dietrich votes no.
Representative Belton,
Belton votes yes.
Representative Berger Givallo,
Berger Givallo votes yes.
Senator Cabrera, Representative Carpino,
Representative Carpino votes no.
Representative Cook,
Representative Cook votes yes.
Representative Dauphiné,
Daphne votes no.
Representative DiCaprio, Representative D'Amico,
D'Amico votes yes.
Representative Denning,
Representative Denning votes no.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon is an enthusiastic yes.
Representative Chavez DeGraw,
Chavez DeGraw votes yes.
Representative Kitt,
Representative Kidd votes yes.
Representative Kennedy,
Kennedy votes no to flag.
Representative Linehan,
Representative Linehan votes yes.
Representative Mara,
Representative Mara votes no.
Representative McCarthy,
Representative McCarty votes yes.
Representative Palm,
Representative Palm votes yes.
Representative Perillo,
Perillo votes no.
Representative Rader,
Representative Rader votes yes.
Senator Rahman, Representative Reddington Hughes,
No.
Representative Ryan, Senator Slabb, Representative Steinberg, Representative Tersiak, Representative Wielander,
Representative Wielander votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Madam Administrator, I'm sorry.
Senator Kushner, how would you like to vote?
Senator Kushner votes yes.
Thank you very much.
Thank you, Madam Administrator. I believe Representative Steinberg had attempted to unmute and we couldn't hear him. If you want to try that again?
Representative Steinberg,
I believe he's now frozen. I will say we've had some tough internet connections here today. Oh, there,
Representative Steinberg votes yes over and over again.
Thank you, sir.
Thank you for your persistence, Rep. Steinberg. With that, and again, votes will be held open until 5 p.m. today. With that, we're moving on to item number 8 on our agenda, House Bill number 5425, an act concerning men's health. This is a JFS to the floor, LCO 3400. May I have a motion?
So moved.
Moved by Representative Kit. Is there a second?
Second.
Second by Representative Welander. I'm going to turn this over to Representative Parker, our good vice chair.
Thank you, Madam Chair. I want to start by thanking Rep. Reyes for his advocacy on this bill.
Rep. Parker, forgive me for interrupting you. If you could use your outside voice when speaking, that would be very helpful to all of us in the room.
How's this? Can you hear me better if I turn my mic up?
Yes.
Thank you for the technical support and for everyone putting up with me from afar. It's worth saying again, then I want to thank Rep. Reyes for his leadership and advocacy behind this bill. And grateful for the chance to get to work on it. As we heard at public hearing, and in the words of the commissioner, quoting the CDC, men die an average of 5 years earlier than women. And men, and especially men of color, are at higher risk for many serious diseases. So that's the impetus behind this bill. And what we've done in the S language is, after working with DPH, really trying to clarify what we imagine the role DPH can play in promoting awareness and education to help men get into care and screening and treatment for diseases that can have terrible impacts on livelihoods and well-being and take a lot of lives. So in this bill, we simply clarify that DPH is going to help with a public awareness and educational campaign. We've articulated this is focused on common diseases affecting high-risk male populations, including colorectal cancer, prostate cancer, hypertension, diabetes, high cholesterol, chronic obstructive pulmonary disease, asthma, infectious diseases, depression, and anxiety. We've also made a call out in the JFS language, in the S language, that community health workers may be involved in this. And then we've asked the commissioner to report on the work of this effort. So we're hoping to align with efforts in DPH and bring some more awareness and resources to lift those up. Happy to answer any questions. Thanks for the chance to share that.
Thank you very much. And I would reiterate my thanks to Representative Reyes for his leadership, and also you, Representative Parker. And when we're through our items, I will have a few words to share about men's health as well, but not on this item. Is there further discussion on the item? Representative Welander.
Thank you, Madam Chair. It's more of a comment. I wanted to share just an interaction that I had this morning with my husband, and as an illustration of how important this is, because after our public hearing on Monday, where Representative Exum testified, I immediately contacted my husband and said, can you please contact your doctor and talk to him about this procedure? And he pushed back, he didn't want to. And then this morning, or then he did, but in the conversation this morning in our kitchen, he shared that he had been having certain symptoms off and on for the last 8 months, and had just said, it's probably not going to be a big deal. It's because of this, it's because of that. And I said to him, do you know that what I'm going to be voting on today in committee? And he said, no. I said, it is a bill that would be pushing for men to talk about their health and not just wave it off, and not just say it's probably because I was exercising or I did yard work or X, Y, and Z. I am so happy and grateful to support this bill and this initiative, because we have so many stubborn men in our lives, and we need to normalize the conversation about their health, their vulnerability, and make sure that we are encouraging them to normalize this type of personal care. So thank you to Rep. Parker. Thank you to Rep. Reyes for everything. I am so grateful for this work. So thank you, Madam Chair.
Thank you, Rep. Welander, for that. Representative McCarty.
Thank you very much, Madam Chair. I've been very quiet today listening to all of the proposals. So I wanted to speak out on this one for a moment because I too want to add my remarks that I think it's so important that we recognize men's health as well. And from the comments we heard, they are more reticent to to go to the doctor, to go to their physician. You have to push a little more. And I know I was so pleased to see infectious diseases in there. I know we've done work on Lyme disease in the state, and I know that's one area also we hear repeatedly that if someone's been bitten by a tick, especially the male population, you have to really encourage them to see the doctor. So I'm very pleased to see this. I hope it won't be limited to the items that are mentioned here and that it will be more expansive. I'd like to recognize Representative Reyes and Representative Parker for their leadership on this. I think it's important as we look at all the various populations that need attention. I think the males definitely need to, we need to continue to promote their health. Thank you.
Thank you, Representative McCarty. And we like our PSAs here to all the gentlemen in our lives. Go call your doctors and get your regular checkups. Senator Anwar.
Thank you, Madam Co-Chair. I just wanted to make a comment and thank Representative Reyes and Rep. Parker for their work on this bill. I joked because hardly anybody actually testified on this. I said, well, what happened to men's health? There's so many testimonies and not a single one on men's health. And but I know it's important issue. So a couple of reminders. Anybody who are around men who actually do not follow instructions for assembling anything or do not ask for directions or look for directions and find their own directions, every time they do that, remind them they have to take care of their health. It's a pattern that you would see. And for many of the cancers, the early identification can completely change and be curative. And prostate cancer is unfortunately on the rise. Colon cancer remains a big issue. These are identifiable, and a simple blood test for the prostate cancer can help identify that. Having the knowledge, having the understanding of this, and then coronary artery disease, heart disease is common in everyone, men and women, but men are during certain age groups are a little bit higher in their capacity to or their vulnerability to get this. So these are all preventable. And the average lifespan in the United States in the last 2 years has decreased. And we are spending the most on healthcare in the world. And then with the lifespan decreasing and decreasing for men, especially the men who are in the minority communities, is speaking not about the men as much as it's speaking about the society in general and our willingness to work on these issues. So this bill is just a starting point. It's just going to scratch the surface on the education part. There's a lot more to be done, but I'm so glad that we are having this conversation. Thank you so much, Madam Co-Chair.
Thank you, Senator Anwar. Representative Kavros-DeGraw to be followed by Rep. Linehan.
Thank you so much, Madam Chair. I apologize that my raising my hand function does not seem to be working today. As you said, we've had some technical issues. I am so grateful for this bill because as you know, those of us who love men, are married to men, have fathers, have sons, have brothers, this is one of those bills that is so critically important. But it means a little more to me today than it would have under normal circumstances. I have a wonderful stepfather who unfortunately had to undergo emergency surgery this morning. He had 2 stents put into his heart because he had an 80% blockage on the larger part of his heart. And I'm sure Senator Gordon and Dr. Anwar could help me understand all of this a little bit better. But it was one of those things where for weeks and weeks and weeks, he was kind of admitting he had symptoms, but not really taking care of them. And lo and behold, last night after an ambulance ride ended up in the emergency room and being kept. So I am just so grateful that as Representative Exum testified earlier this week, and as we all have been talking about, we are going to continue to fight for the men in our life and to make sure that we are making, that while we're educated, they are educated as well, and that they are getting all of the tests so that they can hopefully catch up to our life expectancy as well. So thank you so much for this bill. I really thank Representative Reyes and Representative Parker for their leadership and to the committee for taking it up. Thank you so much, Madam Chair.
Thank you, Representative Cavros DeGraw. Representative Linehan.
Thank you very much, Madam Chair. And thank you, Senator Anwar, for calling out basically my husband, who is here working from home today and heard everything that you said. And I'm really trying to get him to go do these preventative care things. But one thing that we were talking about is at the age of 25, I think it was, my husband was diagnosed with melanoma. And we didn't even think to check. It just so happened that we were at brunch and someone we were at brunch with mentioned it. And so, especially the men in my lives, I think about them. They're outdoorsy. They fish all the time. They're always out in the sun. And we've gotten to a point now, luckily, we caught it for my husband, and it was many, many years ago, and he's okay now. But had we not gone to the doctor then, I might be a single mom. So I'm really concerned about that. And I know that the language in this bill does say, including but not limited to, and I think it's really important to say that. But I do believe that especially these diseases that can affect people younger and younger need to be specifically called out in the legislation so that they don't get lost. So I thank everybody for the work on this bill and for the support, but let's just think about if we are going to be naming certain concerns in the legislation, I really do believe that melanoma needs to be listed, skin cancer in general, especially if we have a lot of male outdoorsmen in the state, like I know that we do. So just that consideration for the floor. Thank you so much.
Thank you, Representative Linehan. Thanks to all for your comments and Senator Gordon. Yes, thank you, Senator Anwar, for the reminder. Senator Gordon, please proceed.
Thank you. And I just want to certainly highlight, this is an important bill. It's always good to educate everybody about what they can do to stay healthy, or if they're not healthy, how to get healthier. So certainly, encouraging men to undergo testing, especially screening, is extremely important. I wish more men would actually get a colonoscopy. Women do a better job going for their colonoscopies. And one last comment I would just like to make. I'm married to a doctor, and I think she'll agree. I listen to everything she says when she gives me medical advice. Hopefully Senator Anwar won't tell her, differently, or believe what she says, that I'm not a good patient. But I can speak from personal experience that wives do a very good job reminding their husbands to seek medical care, especially when they have symptoms. So I wish they would continue to do that. And I want to do a big shout out to the medical community that continues to highlight to men to continue to get their testing and continue to seek care when they have symptoms, and to get their screenings done, all of the ones that are recommended. So I will support this bill.
Thank you for those very important reminders. I appreciate that. Senator Anwar.
Thank you, Madam Chair. I just wanted to mention, I happen to share many patients with Senator Gordon's wife, who's a cardiologist and provides excellent care in some of the rural parts of our state. And I take care of some of the patients in the rural parts of our state. And so wanted to thank him for mentioning that. Thank you.
Thank you, Senator Anwar, and for your comments, Senator Gordon. Representative Berger Gervalo.
Most of what I wanted to say, thank you, Madam Chair, was already said. So I will just say that I am encouraged by the fact that this seems to be a trend. Last year in this committee, we added lung cancer screenings to a series of screenings that generally focused on women's health, and now we have become more inclusive, and it just seems like this is probably a pretty good path for us to continue on. So thank you very much for the opportunity to add to that little menu of things that we are expanding, and thank you for the opportunity to speak.
Thank you for highlighting that. I appreciate your advocacy as well. With that, Madam Administrator, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vahey,
McCarthy-Vahey votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Marks, Representative Parker,
Representative Parker votes yes.
Senator Summers. Representative Clarice Detrier.
Clarice Detrier votes yes.
Representative Belton.
Belton votes yes.
Representative Burger Givallo.
Burger Givallo votes yes.
Senator Cabrera. Representative Carpino.
Carpino votes yes.
Representative Cook.
Representative Cook votes yes.
Representative Dauphiné. Representative DiCaprio. Representative D'Amico.
D'Amico votes yes.
Representative Denning.
Representative Denning votes yes.
Representative Elliott. Representative Django.
Yes.
Representative Gilchrist. Senator Gordon.
Senator Gordon votes yes.
Representative Cavers DeGraw.
Cavros DeGraw votes yes.
Representative Kitt.
Representative Kitt votes yes.
Representative Kennedy.
Kennedy votes yes.
Representative Linehan.
Representative Linehan votes yes.
Representative Morrow.
Representative Mara votes yes.
Representative McCarty.
Representative McCarty votes yes.
Representative Palm.
Palm votes yes.
Representative Perillo.
Perillo votes yes.
Representative Rader.
Representative Rader votes yes.
Senator Rahman. Representative Reddington Hughes.
Reddington Hughes votes yes.
Representative Ryan.
Votes yes.
Senator Slapp. Representative Steinberg. Representative Tersiak. Representative Wielander.
Representative Wielander votes yes.
Representative Zupkis.
Zupkis votes yes.
Thank you, Madam Chair.
Thank you, Madam Administrator. Before we disperse, I will remind everyone first, before I make a few remarks, that votes will be held open until 5 p.m. today via Zoom and in room 3000. But before we do all go our separate ways, I would like to take a few moments, if I may, to begin with saying thank you. And I have learned and been reminded this year of just how important it is to be sure that we thank and appreciate one another. And I have a few thank yous as we conclude our JF work that I would like to share, beginning with my good co-chair, Senator Anwar, who's a tremendous support and hard worker and just an amazing co-chair, as well as Representative Clarice Detrier and Senator Summers. It is a privilege and an honor to work together with them to build friendship and relationships, to learn from one another, to exchange ideas, and it truly is a privilege, as it is to be on this committee with each and every one of you. This is our final meeting together, as this is our second year in the term. The committee will certainly be a different group next year when we come back to the committee process. And it's really been a joy to work with all of you. And we have a lot of committees where not many people are able to be present. And I find that there are a lot of us here together, and that really makes a difference. Also, an enormous thanks to the woman behind the scenes who is the glue of this committee, Beverly Henry, Madam Administrator, who is just, yes, exactly. An absolutely amazing person whose experience and knowledge and wisdom has brought us and many chairs before me through this process, before us, through this process. And with her, the team, Kathleen, the voice, our voice. Excuse me, please. Your time is up. but Kathleen and Dave and David and Peter, who is our new clerk this year, who's done a phenomenal job. It's been a pleasure to have you. As I've mentioned a few times today, our superstars who are here with us, our nonpartisan attorneys, our LCO team, Eileen and Nick, and our OLR team, Nicole and James, are absolutely incredible. And just constantly, yes, thank you so much. As we legislators like to say, we write laws, but we really don't. They do. And we couldn't do this without them. Senator Anwar is always great about reminding us to thank CTN for providing the opportunity for the members of the public and those of us who can't make the meetings, the ability to watch afterwards or during. Thanks to our OFA analysts who are behind the scenes a lot. We don't necessarily see. And thanks also to our families, those who support us in doing this work and being here. And most of all, thank you to the people of Connecticut who come before us, who spend hours with us at the hearings, who email us and talk to us and catch us in the hallways and inform us and allow us to shape legislation that is just hopefully the best legislation we can. And if I may, I know it's Friday, but I'd just like to take a quick moment of personal privilege. Many of you know that early this year, my 43-year-old brother-in-law was admitted to the hospital. He had the flu. He was admitted on January 2nd, and we spent the month in Pennsylvania in the ICU. I learned a lot more than even I've learned here in these hearing rooms and through all of you. And unfortunately, on January 28th, he died. He was 43. He was healthy. And he leaves behind my sister and their 3 children. I just want to say a special thanks to everyone on this committee for your support during this time, and to so many colleagues, to all those who have been patient with me, because indeed the process in this committee has been a little bit different this year. And that's part of the reason why. I've been in a bit of a cocoon with my family, and I am coming out of that cocoon little by little, and I'm ready to dive in more with all of you to really get into the work. We know we have a lot of work to do. But talking today about men's health and talking about the work we do, wow, it really impacts us personally in our day-to-day lives, what we talk about in this committee, the health, the issues of public health. And so I just want to say a tremendous, tremendous thank you. And I know that we will have other chances to thank and support one another. But as I often say, we look at policies, we look at laws, we look at a lot of words and documents, but in the end, we're all people. We're humans, we're neighbors and friends, and that's what this work is about. And with all of that, I thank you for indulging me, and I thank everyone, and I'm going to turn it over to Senator Anwar.
Thank you, Madam Co-Chair. I have nothing to add. I think we should leave it with what you have said, and I just want you to know what an amazing co-chair you are, and how you have taught me so much about going through process, making sure taking everybody with us in the process, your transparency, your commitment to making sure that everybody gets to get all the information in a timely fashion. All of those things are qualities that make me hopefully a better person and a better person to be able to serve in this committee. But how you continue to work hard despite grieving and in making sure that we do everything that we can. I also know that many of our committee members, they have had losses as well. I don't want to mention any names, but I just want you to know that what we smile and we laugh at times in many of the meetings, but this is very real stuff. It takes an impact and toll on each and every one of us when we hear the testimonies and when we hear how many of our colleagues are grieving with some of the challenges and losses that they endured, and then they continue to come and work to make sure that their experiences, their pain is going to change and improve things for the better for the people in the state of Connecticut. I feel privileged to be able to sit with many of my colleagues. We agree, we disagree on things, but I know that we are all trying to do the best for the people that we represent. It's such a privilege to be with my co-chair, our ranking members, and an entire team. So I was thinking that there's a mic drop, so I didn't want to say anything, but I think I just wanted to add a couple of thoughts. Thank you so much.
Thank you, Senator. Representative Clara DeStitrio.
Thank you, Madam Chair. I want to thank, I mean, there's so many people to thank, but I need to thank my ranking member in the Senate, Senator Summers, for being my partner in crime constantly with all things public health. I need to thank the rest of our Republicans on the Public Health Committee. We work, that's what it's about. It's about working well together and compromise. And we couldn't do this without our support staff, without Adam Johnson and Jared. They keep us in line sometimes when we need it. And, you know, LCO and OLR for their tires work constantly. And poor Eileen, she's like, I just don't have any more bandwidth. I can't. And we try often to keep it simple for them. To Bev Henry and her staff, you know, kudos to all of you. You do an amazing job. And to our co-chairs, it's been an honor to work with you these last 2 years. Hopefully we'll continue. You can get it on CTN. Hopefully we can continue to work together. We disagree on a lot, but we do agree on many things, and we work together. The goal is to compromise and to make the best bills that come out of this committee, be proud of it, and help the citizens of the state of Connecticut. And that's what I hope we will continue to do. Kristen, we are here for you always. We love you, and anything you need, you come to any of us whenever you want. Thank you.
Thank you very, very much for that. And as we talk about our squeaky mic, I also want to make sure that I add our IT support people who have helped us with everything from plugs to microphones to everything, and to our policy staff and our caucuses as well, and everyone who has had a hand in all of this. So with that, I believe Senator Summers is not here, and we're sending her thanks in her absence. But with that, we are in recess, and votes will be held open until 5 p.m. on Zoom and in room 3000. Thank you all.
Test, can you guys all hear me? Okay, I'll go with Representative Parker first.
Hey, thank you.
Okay, so I'm missing you for item number 1, SB number 9.
Rep. Parker votes yes.
Item number 2, SB number 241.
Rep. Parker votes yes.
Item number 3, SB number 242.
Rep. Parker votes yes.
Item number 4, HB number 5200.
Rep. Parker votes yes.
And I have you for this one, and for this one, this one, this one. On HB, and then item number 9, HB number 5488. How would you like to vote?
Rep. Parker votes yes.
And I think you're all set.
Thank you so much. Have a good weekend. Thanks, everyone. Bye.
Next, I'll take Representative Jillian Gilchrist.
Great.
Let's see.
Thank you. I
Mhm.
think I'm just the last two.
Let me just make sure. Okay.
Okay.
Gilchrist, got you for that one. Item number, I'm missing you for item number 8, HB number 5425. How do you like to vote?
Yes.
Yeah. Yep, that was the only one you're missing, I think. Wait, let me just make
Okay.
sure.
I missed the final one too, like number 8 and 9, I think. The men's health and then
For men's health, you said?
yeah, I think I missed men's health. I was on for part of the debate and then I had to get off.
Mhm. No. No, I have you for that one.
Oh, okay. So it was just number 9, 5488.
Yeah, I believe so, yeah.
Okay, awesome. Thank you. Have a great weekend.
Thank you. Next, I'll take Representative Mara.
Thank you.
I have you for SB 9. SB 242, I have you, or 241, 242. Item number 4, HB number 5200. How would you like to vote?
Rep. Mara votes yes.
Okay. Item number 5, HB number 5290. How do you like to vote?
Rep. Mara votes no.
Item number 6, HB number 5318. How do you like to vote?
Rep. Mara votes no.
Okay, you're all set. Thank you.
Thank you so much.
No problem. All right, next I'll take Senator Rahman.
Yes, yes.
Okay,
So I think I missed couple of, I
Yeah.
don't.
I'll check. Rahman. Item number 5, HB 5290. How do you like to vote?
Yes,
Item number 6, HB number 5318. How would you like to vote?
5318, you said?
Yeah, number 6. Yes, item number 6, 5318.
Okay, 5318, I want is, abstain, don't want to vote.
Okay, I abstain. Item number 7, HB number 5319.
Yes,
Item number
Oh, I guess I should put
8.
it back on.
Item number 8, HB 5425. How do you like to vote?
yes,
Yeah. And then let me just make sure I got you for 5488. And then item number 9, HB number 5488. How do you like to vote?
Yes.
Okay. You're all set, Senator.
All right. Well, thank you so much. Appreciate it.
I was told I missed the 548, the very last one. 548, you said they missed, you missed? Well, I don't think I was. Oh, okay. Okay, I just need you on camera. Okay, that's fine. But I think that's the one, right? Yeah. Senator Gordon, how would you like to vote, Senator Gordon, on HB number 5488? Senator Gordon votes no. Okay. I got you. Thank you. Okay. Senator Stop, I can take you next. Sorry for all the commotion, guys. Yeah. Oh, Senator Stop, I can take you next.
Okay, thanks.
Okay. Item number 1, SB9, how would you like to vote?
Yes.
Item number 2, SB number 241, how would you like to vote?
Yes.
Item number 3, SB number 242, how do you like to vote?
Yes.
Item number 3, HB 5200, how do you like to vote?
Yes.
Item number 5, HB 5290, how do you like to vote?
Yes.
Item number 6, HB 5318, how do you like to vote?
Yes.
Item number 7, HB number 5318, how do you like to vote? Sorry.
Yes.
And then item number 8, HB number 5425, how do you like to vote?
Yes, please.
And then item number 9, HB number 548, how do you like to vote?
Yes.
Okay, you all set.
Thanks so much. Have a good weekend.
Yeah, you too.
See you, Liz.
And finally, Representative Linehan.
I'm sorry, did you call my name and I wasn't here?
I don't believe so.
Okay, good. I was so nervous because I got called
Oh,
away
no,
and
no.
I'm like, no, they're waiting for me.
All right, there's a few of them. There's a few of you guys. Okay, let me just make sure. So
I think
got
I'm just missing the first one.
SB9.
Is that what it was?
Oh,
The
oh,
first
wait, no.
vote?
Oh wait, no. The first vote was HB number 5488. Let's see. I am missing you. How do you like to vote? That's item number 9.
No.
No? Okay. I'll just make sure that you're not missing anything else.
Thank you.
Okay, you're all set, Representative.
Thank you. Thank you. Have a super duper day. Thank you
You
for
too.
all your work. Bev, to you too. And I see Jonathan's on. So bye, Jonathan.
All right. Item Item number 1, SB9. How would you like to vote?
Yeah.
Yes. Item number 2, SB number 2.
Representative Terciak votes yes. The rest I can just go.
Item item number 2, SB number 241. How do you like to vote?
Vote yes.
Item number 3, SB number 242. How do you like to vote? Item number 4, HB 5200. How do you like to vote?
Yeah.
Item number 5, HB 5290. How do you like to vote? Item number 6, HB 5318. How do you like to vote?
Yes.
Item number 7, HB number 5319. How do you like to vote? Item number 8, HB 5425. How do you like to vote? And then finally, number 9, HB number 548. How do you like to vote? Okay, you're all set.
Thank you very much, Joe.
No problem. And Representative Steinberg, I see you.
Oh.
Hi there.
I'm so sorry.
Thank you.
You can't hear. I can't hear you. Is it because of me or?
I have the earbud in. I know. All right, Representative
I'm
Phil.
sorry. Talk- You know. No, yeah. Tough one, Jonathan. I'll talk to you later.
Thanks.
He
What'd
said,
you say?
he said thanks.
Okay.
Okay. All right. Let's see.
At least he was ignoring.
I know. Okay, so I
Hi,
have you.
Peter.
Mhm,
Peter,
yes.
Steinberg is missing 5200, 5318, and 5425.
5200. Okay. How would you like to vote,
Five-
Representative? On
5318
Let me see. 5318. Let me just.
and
step in.
5425, Men's Health.
Okay, so 5200,
Okay.
5318,
You're
and then
welcome, Representative.
5425. Okay. Okay. HB number 5200. How do you like to vote?
Representative Steinberg votes yes.
HB number 5318. How do you like to vote?
Representative Steinberg votes yes.
And HB 5425. How would you like to vote?
Representative Steinberg votes yes.
Okay. All right. You're all set.
Thank you. Have a great weekend. Thanks for everything.
Yeah, no
Take care.
Bye. You're not muted, Bev. Sorry, I have to get that up. Okay.
No worries.
Yeah, let me just make sure.
Where are you?
I'm in the middle of the LOB.
That's what it looks like. They kicked you out of the office or what?
I was moving and you joined in, so I said I'm just gonna sit down and I'll do you right now.
Oh, aren't you sweet? I was like, what are you doing out there?
Okay. I'll just see which ones you missed. Okay, what's the document? I got your SB9. I'm missing you for HB number 5200. How do you like to vote? That's agenda number, or that's item number 4.
5200?
Yeah.
No.
Okay. For that one. I'm missing you on item number 8, HB number 5425. How do you like to vote?
Yes. And then I think you're missing me on number 5 as well, aren't you?
5290. Oh, where is it? Oh, right here. Yes, I'm missing you for item number 5, HB 5290. How do you like to vote?
No.
No, okay.
I think that's it, but you let me know.
Yeah, you're all set.
Thank you so much. Thank you for taking the time to stop too. I appreciate that.
It's no problem. Have a good day.
Have a great weekend.
You too. Bye.
Bye.
Okay, I can see you, Representative. Are you ready?
I am.
Okay. Item number 1, SB number 9, how would you like to vote?
It's gonna be no.
Item number 2, SB 241, how would you like to vote?
No.
Item number 3, SB 242, how would you like to vote?
No.
Item number 4, HB 5200, how do you like to vote?
I'll be a yes on number 4.
On number 4, okay. Item number 5, HB 5290, how would you like to vote?
I'll be no on 5.
Item number 6, HB 5318, how do you like to vote?
Five, 3, 1, 8 is a no.
Okay, got you. Item number 7, HB 5319, how do you like to vote?
Okay, that'll be a no.
Item number 8, HB 5425, how do you like to vote?
I'll be a yes on 8.
And then number 9, HB 5488, how do you like to vote?
There'll be a no on 9.
Okay, you're all set.
All right, you have a
Have
good
a good day.
weekend. Thank
You.
you now.
Bye. Okay. All right. Are you ready?
I am.
Okay. Item number 3, SB 242, how do you like to vote?
Vote no.
Item number 4, HB 5200, how do you like to vote?
Yes.
Item number 5, HB 5290, how do you like to vote?
Yes.
Item number 6, HB 5318, how do you like to vote?
Yes.
Item number 7, HB 5319, how do you like to vote?
No.
Item number 8, HB 5425, how do you like to vote?
Yes.
Item number 9, oh wait, no.
I think
Okay,
we're.
yeah, you're all set, sorry.
Thank
Okay.
you.
Yeah. Have a good
Okay.
day.
Bye-bye. Have a
Bye.
nice weekend.
You too. Bye. Okay. Are you
All
ready?
right.
Are you ready?
I'm so ready.
Okay. Item number 1, SB 9, how would you like to vote?
Yes.
Item number 2, SB 241, how would you like to vote?
Yes.
Item number 3, SB 242, how do you like to vote?
Yes.
Item number 4, HB 5200, how do you like to vote?
Yes.
Item number 5, HB 5290, how do you like to vote?
Yes.
Item number 6, HB 5318, how do you like to vote?
Yes.
Item number 7, HB 5319, how do you like to vote?
Yes.
Item number 8, HB 5425, how do you like to vote?
Yes.
And then number 9, HB 5488, how do you like to vote?
Yes.
And you're all set.
Thank you.
No problem. Have a good day. Hi, Senator Marks. Okay. I'll try to be as fast as possible. Okay.
Hi,
Item number
Senator.
Hi, Bev. I'll send you a picture of the baby when I see her.
Okay, great. Thank you.
Yeah.
Okay.
Okay,
Great.
Peter, go ahead.
Item number 1, SB9, how do you like to vote?
Senator Marks votes yes.
Item number 2, SB241, how do you like to vote?
Senator, yes.
Oh, you're gonna have to do that one more time.
Do-
Oh, there's connection issues. Oh, I see you now. SB241, how do you like to vote? Oh,
Senator Marks votes yes.
okay. Item number 3, SB242, how do you like to vote? Oh,
Senator Marks votes
Peter, are you frozen?
no, she is. Is she frozen for you or no?
Senator Marks votes yes.
Oh, your camera's frozen, Senator. Oh, she'll come back.
The Cabrera came in.
Okay. All right. So we left off with item number 3, SB242. How do you like to vote? Oh, no, he froze again. Okay. Item number 3, SB 242, how would you like to vote?
Senator Marks votes yes.
Okay, got you there. Item number 4, HB 5200, how do you like to vote?
Senator Marks votes yes.
Okay. Item number 5, HB 5290, how would you like to vote?
Senator Marks votes yes.
Item number 6, HB 5318, how do you like to vote?
Senator Marks votes yes.
Item number 7,
Senator
HB
Marks votes yes.
5319. Is that a yes?
Senator Marks votes yes.
Okay. And then item number 8, HB 5425, how do you like to vote?
Senator Marks votes yes.
And then finally, item number 9, HB 5488, how do you like to vote?
Senator Marks votes yes.
And you're all set.
Appreciate you, Peter. Thank you.
No problem. Bye. Have a
Have
good
a
time.
good weekend.
You too.
Yeah,
Bye.
bye-bye. Ah, you're